Hi everyone, and welcome to an episode of Senior Living Live. My name is Mary Kate Spires, and we are here on site in Cooper City, Florida at Arbor Terrace, Cooper City. I'm so excited today. We are going to be talking more about senior health and the importance of going to the doctor. We have a very special guest, Miss Carleen Brownlee. I am so excited to have you here. Why don't you go ahead and introduce yourself and let us know what you do here.
Absolutely. Hi, thank you for having me. My name is Carleen Brownlee. I'm a nurse practitioner here at Arbor Terrace. I do work under Healthstone with Dr. Ivancho.
Alrighty, so not everyone loves going to the doctor, myself included, but we want to talk today a little bit about how important it is to consistently get checked up. Can you speak a little bit to that?
Yes, so my position as a nurse practitioner, we will come here once a month to visit the patients for their chronic conditions, hypertension, hyperlipidemia. A lot of times patients have thyroid issues, and it is very important to follow up to be seen by your primary care physician to get the assistant needed care because you're not able to go out to your PCP.
And so let's say a senior is still at home, they might not have moved yet. How often should they be going to the doctor?
If they have their chronic medical condition, especially with hypertension, I'm going to say as an example, at least every 3 to 6 months.
And so maybe let's say a little earlier, we all are told to get our annual physical,
Absolutely.
which some of us are better at than others, as we've discussed. But let's say, a senior comes in for their annual physical, they've been relatively healthy. What are some of the things you all may look for in a senior patient?
In the senior geriatric population, we will look more for the care of an older adult. And that being, is that patient still able to feed themselves with their annual physical? Are they able to still walk on their own without needing assistance of a cane or a walker? Does that patient needs more care as far as incontinence? Are they able to go to the bathroom without assistance? Are they wearing Depends? All of that is part of their annual visits. With that also comes is their annual, every 10 years they should have a colonoscopy just to make sure before they're 65, I think. Just to make sure there's no colon cancer and screening to be done. A lot of times with the elderly, we need to screen them for risk for falls, for risk of needing more assistance in the need. Here at Arbor Terrace, they do offer assistant living. Is not where there be a total care.
And so you talked a little bit about some chronic illnesses. What are some of those that people should watch out for?
With that being said, one of the chronic ones that I've been mainly monitoring is the hyperlipidemia, which is the elevated cholesterol levels. We do their blood work, have it ordered, and one of the good things about being here is that the facilities offer different companies mobily to come here and draw their labs. So the patient does not have to actually leave the facility to get their blood work done or to have their EKGs done or even to have their x-rays done if they have a cough or a cold. We do provide them with that assistance here at Arbor Terrace.
That's amazing. You never have to leave if you don't want to.
No.
You just come
Not
straight
unless
to
it's
you.
urgent.
Yes, of course.
Urgent care, I will send you out. Yes. Yeah.
What advice would you have for seniors or even all of us for really, taking care of yourself outside of making sure you're hitting that annual physical?
That would be number one, the annual. Don't forget that you are offered this through your insurances. And we do have to do the pre-screening to make sure that you don't have any cancer, pre-screening for the cholesterol, pre-screening for the hypertension. We do all pre-screening with you being here in the facility, and the assistance is offered here wherever you go.
It's amazing. All right. Well, I think that is everything that I have for you. Is there anything else you'd just like seniors to know?
At the facility, they also offer physical therapy and occupational therapy. Speech therapy is also offered here. That is also being mobile. Once the physician puts in the order, we put in the referral, and the companies or home health agencies will come out and actually do the evaluation on the facility and see if the patient needs any further assistance with their mobility. So, before I forget, yeah, that would be very important.
What kind of thing, what might be a reason why someone needs that therapy?
If they've had a recent fall, or if they just developed weakness with lifting or getting out of bed, or they notice that their legs are more weaker than usual and their request to be evaluated.
And what about speech therapy?
Speech therapy comes with the correlation of vocabulary words. One, are they able to chew? That can also be evaluated with their swallowing. Sometimes they have difficulty with swallowing pills, and maybe we might need to change their diet. So speech therapy comes in and also evaluate how they're swallowing and how they're pronouncing letters and words. Are they able to correlate, or have there been any, decline in their care?
Absolutely. So you all, the community, doctors, therapists,
Yes.
are all working together for that holistic health.
Yes, and the one thing that I did forget to mention is that they also offer evaluation for anyone who needs to see a psychiatrist.
Oh, wow.
Yeah, we can put in the referral, and psychiatrist also does visit.
You guys are doing everything. It's great.
We try.
Taking
We
great
absolutely
care.
try, yes.
Fantastic. Well,
Yes.
I cannot thank you enough for stopping by during, I'm sure, a very busy schedule to
It
chat
is.
with us.
It is, but it's okay. A little time to educate doesn't hurt.
Absolutely. Thank
Yes.
you so much.
You're welcome. Thank you for having me.
All right, everyone. If you are interested in learning more about health and senior living, you can see videos like this and more at seniorlivinglive.com. And that is it for now. Thanks, everyone.